Hello everybody, good morning, good afternoon, good evening, and welcome to the Toronto Waterfront Marathon Women's Training Program. My name is Lauren Roberts. I am a registered physiotherapist and the owner of the Running Physio in Toronto. You can find us at Queen and Dufferin. We treat all injuries but specialize in treating running related injuries. Now, one of the most common injuries that we see, particularly women for a little bit more than men, is knee pain. So today I'm going to talk to you about 3 different reasons of why you might be experiencing knee pain and 3 super simple, quick exercises that you can do about it. You can use no equipment at all for these exercises, or optionally you can use a loop band, a longer TheraBand, or potentially a foam roller if available to you. Again, these props are optional but useful for the 3 exercises I'm going to show you. So knee pain, as I mentioned, is the most common problem that we see people at the clinic for. Women are slightly more likely to experience knee pain than men. It's potentially because of the angle between our hips and our knees is a little bit greater. Therefore, as we're running, it's not uncommon for there to be a little bit more strain, particularly along the outside part of the knee, in which case it might be a bit more like a T-band, or sometimes we can have pain sort of diffusely like a horseshoe on top of the kneecap, or ever so often on the bottom part along where the tendon is, although that's a little bit more commonly seen with jumping sports like basketball and volleyball. Regardless, one of the main reasons why we can have knee pain is if we have stiffness in our ankle joint. So, option here to grab your longer band. A shorter loop would work as well, just a little bit more tricky. Take the band, come into a half kneel position. The band's going to go right along the joint line of your front ankle. So think as close to the ankle sock line as possible. I know we're not supposed to be wearing ankle socks anymore, but nonetheless, here we are. Ankle sock line, the back portion of the band is going to anchor down behind your back knee, okay? If you're using a loop, same thing. You can just put the loop around the front of your ankle and anchor it down behind. Sit tall. Be sure you're pulling right through that joint line again with that band. Fair amount of tension here, okay? It's a big, thick, strong joint. Hands can go on top of the thigh, just on top of the knee of the front leg, and gently rock your knee forward over the ankle. You might feel a stretch in the back of the the back of the calf, potentially behind the ankle joint down here. All of that's acceptable. You might even feel a little bit of tightness near the front of the ankle too. If you feel that, you can be fairly sure that this is potentially a culprit of your knee pain, okay? You can rock back and forth here. You can also hold and windshield wiper the knee in and out, so over towards big toe, back towards baby toe, or for a slightly more aggressive stretch, hands can go on the ground and really focus on driving that knee as far in front of the front toes as you can. 6 to 10 reps here is fine, or about a minute or so. Okay? This should not be painful. It might even be uneventful. Regardless, this is great practice for mobilizing our ankles. Super. So moving up the body, the second reason why we might see pain, particularly if you're in the top part of the knee, if you're one of those people that has that horseshoe pattern of pain, what potentially might be the issue for you is tightness in through the quads, or the big muscles in front of the thighs. Here's where your foam roller or a lacrosse ball or a small yoga ball can be really helpful. I'm going to use the foam roller for today. Lay this guy horizontally across your mat or soft floor and drape yourself gently over the foam roller, and then pull your body up so you can feel the bottom of your thigh muscles. I'm about 2 inches above my kneecaps, okay? So the classic foam roller thing is this sort of like active business here. This can be hard for a lot of people. It can be challenging for us, especially if we're women and we're a little bit more top heavy. So what I usually suggest is fully relax your body, relax your legs, even if they're hanging in the air, and then take one leg at a time and bring heel in towards bum. Woo! So here we are. We're lengthening through the front body here, lengthening through those quad muscles. And usually after you've done a couple, I can tell that just to my left is a bit of a tough spot. So a little bit of a trigger point there, a bit of a motor point. So I'm going to rotate my legs slightly over that spot. This works really well with a lacrosse ball too. And I'm just going to repeat. If anyone's ever had ART done or active release therapy, essentially the premise of ART is pinning the muscle and then lengthening it, which is essentially what we're doing here. After you've done this a few times, and it's feeling like it's loosening up, you can drag your body back a little bit to the south end of the mat, find another spot within those muscles. I'm going to switch to my other leg here and repeat. Heel to bum. This is just a muscle release. There's not a huge right or wrong with it, so don't get too caught up in being a perfectionist around it. Ultimately, you're just sort of researching how each of these locations feels, adjusting, and then repeating, okay? And you can basically go all the way up the length of the thigh muscles from just above the knee as high up as the hip flexors up top, okay? Again, that's really great if you're experiencing pain, particularly through the top part of the quads, okay? Now, lastly, if you are that person that has tight quads, quite common, often the reason why we have tightness is because there's a muscular imbalance somewhere. So I like to always tell my patients that people aren't naturally tight. We're not organically tight. Our bodies are not meant to be feeling tight. Tightness is a symptom of something else. It could be weakness in that actual muscle. More often than not than runners, what we tend to see is there's tightness in the front because there's weakness in the back, okay? So for this last exercise, I'm gonna come on my back. I'm going to show you the sort of intermediate level 2 version of this using the band, completely optional, okay? Band's going to go around my feet here, okay? Just equally, you can see, around both of my feet. Lying comfortably down on my mat, I'm going to bring my feet relatively close to my bum. I'm going to have my whole foot on the ground, but my weight is primarily in the heels, okay? From here, I'm going to scoot my pelvis under. I'm going to move my right arm, my left arm so you can see, okay? But arms can be down your side. Scoop the pelvis under and think about bringing your bum crease to the back of your knee. So I'm dragging my back long-wise as I'm lengthening through my lumbar spine here. Keep on curling and come up to a glute bridge. Note this is not a yoga bridge. Yoga bridges tend to be more from the low back in here. I really want you to focus on the scoop, pulling the rib cage down towards the pubic bone, and keep the low bum, the bum crease, going to the back of the knees as you pull up, lengthening through the low back. From here, if this is enough, you can just repeat this exercise. Alternatively, and I need my hand down here for a bit of stability, you can show me a march. So I'm just dorsiflexing or bringing my foot up towards my face, lifting up, pause, and down. And even though it looks like the leg moving is working hard, it is, what we're actually focusing on is that leg that's on the ground. So my left bum, in this case here, is stabilizing my hips, keeping my hips level as my hip flexor on the right pulls up towards my chest. And does this position look familiar? Have we seen this before? This is one of my favorite exercises for runners because it so closely approximates what happens when we go running. You can repeat through that maybe 3 or 4 times. Come back on the floor and rest. Alternatively, you could just go right, left, and rest, and repeat. So this is a great complementary exercise, particularly to that second exercise. But if you do find that you're just generally feeling tight through the front of the body, maybe you work a desk job, those exercises are absolutely great for you. So, in summary, your knee pain could be caused by anything above or below the knee, okay? If you think maybe you've got some tightness in the calves, tightness in the ankles, that first exercise, that ankle mobility is probably gonna be your winner. If you feel like you're a little bit tighter, a little bit more restricted through the hips, give those last 2 a try too. You can find us at Queen and Dufferin, the Running Physio. My name is Lauren Roberts. Happy training.